Well, welcome to One-on-One. I'm Steve Adubato. It is my pleasure to introduce, for the first time, Dr. Celinés Morales-Ribeiro, who is a bariatric surgeon at Englewood Hospital and Medical Center. Good to see you.
Thank you for having me.
I think there's some confusion about bariatric surgery. What is it?
Bariatric surgery is weight loss surgery. So there are a few different types of surgeries that can be done, but it's a surgery after you've attempted numerous dietary programs or regimens to lose weight, and you're having a difficulty losing the weight. So sometimes your team of doctors refer you and to see if you're a candidate for weight loss surgery.
Obesity, a big problem?
Obesity is a big problem
How
in the
big?
United States. They say about over a third of adults in the U.S. Are obese. About over 15% of our adolescents are obese.
Can we define it? How do we define? Like, what is the body mass index thing? Like, there's so confusion about that. People go, oh, let me get out that thing where I measure your body. Like, what? Get that thing away from me. Like, is that the way we do it?
It is, especially measured if you're a candidate for surgery. Your body mass index is a calculation. It's based on your height and your weight, and you plug it in and it tells you what your BMI is. You know, an ideal BMI usually in your 20s, and as it goes up, that means you go from ideal to overweight to obese to morbidly obese.
Is over 40 obese?
Over 40 is morbidly obese.
Morbidly? Mm-hmm. Obese is over 30?
And between 35 to 39, you're then considered obese. So morbidly obese, you're usually, your BMI is greater than 40, or you're over 100 pounds over your ideal weight.
Wow, wow. So again, different kinds of bariatric surgery. Governor Christie had what kind of surgery?
Governor Christie had a completely restrictive procedure. When you look at the bariatric procedures, you think of restrictive and malabsorptive. So restrictive meaning that it literally restricts the amount of food you can take in. So the true restrictive surgery would be the band. So he had a band placed at the most top of his stomach, sort of creating what I like to call a pseudo pouch, because it's not a true pouch because the stomach is not divided, but he eats a small amount of food. It sort of gets held up right at the top of the stomach, and it sort of gives him a feeling of fullness. So then he should slow down his eating and eat less, and then in turn he'll lose weight.
And the other types are?
The other types of surgery are the gastric bypass, which has been around the longest. It's not only restrictive, but it's malabsorptive, meaning restrictive because in that surgery we actually do cut and staple the stomach, creating a small pouch.
It's just a smaller stomach.
Yeah, it's a smaller stomach, but also to that surgery, we go down below to the intestines, cut the intestines and reroute it. So instead of now going through eating and going through your esophagus, your stomach, and the beginning of the small intestine, it goes the esophagus, small pouch of the stomach, and directly to the distal part of the intestines.
Is that the most invasive?
You know, people always come and say, I don't want to have the bypass, or the other one I haven't talked about yet is the sleeve because it's too invasive. In reality, all of them we do laparoscopically. You get 5 little incisions, so they're all invasive, and meaning you all have to have general anesthesia and we are going to operate on you. But I guess with the bypass, it's the one that we do the most cutting and rerouting of intestines, and that causes the malabsorption component.
Question. The bariatric surgeries you just described, are they a cure for obesity?
I think they are a help. It's not a quick fix. It's not an easy solution. It is a tool. And this is what I try to explain to my patients time and time again, that this is by no means a quick fix. You can't just come into the office, say, I'm 100 pounds overweight, I have diabetes, high blood pressure.
Yeah, fix me.
Yeah, fix me. No. It helps tremendously. They lose a tremendous amount of weight. Their medical problems usually get much better or go away. However, they have to do their part also.
And there's a big emotional psychological piece to this.
Absolutely.
Describe it.
Well, again, you know, before they even get to surgery, they have to have a psychologic evaluation. But it is a huge component because so much of their lifestyle completely gets altered. Not only, you know, the amount of weight that they're losing, but what they're used to their entire life of the way they were eating, what they're eating is completely changed. And a lot of people in reality, their food was their addiction, so now they can't turn to that. So sometimes you can see them turning to other addictions. So you have to make sure that emotionally, psychologically, they understand and they're ready for these major changes so that they don't go to other addictions.
So you just led to my next question, life after surgery.
Most people, life after surgery, they are, I don't know, they're ecstatic. They're so happy, especially.
How do you know? How do they communicate that to you?
Well, yesterday I saw a good number of patients, and yesterday was a great day in the office. This is my favorite type of day, when people come in, and I did a few of them. We see them several times throughout the year, but yesterday I saw a number of people that were at their 1-year mark. And people came in crying. Somebody brought me a whole bouquet of flowers. Their life completely changes. It just,
For example?
This guy, one guy, he came in, he has lost over 100 pounds. He lost 120 pounds. He emotionally was very depressed, didn't have a job, didn't like to go out. Now he's like, I would have never thought that at 52 years old, my life would have changed. He has a job, he has no sleep apnea, his diabetes has gone away, no blood pressure, on no medications, had increased self-esteem, is going out, found himself a girlfriend, is now engaged, moving to Florida. So he's ecstatic.
It goes all the way from great stuff like that to people who couldn't pick up their kids before, right?
Exactly. I have another patient. She has lost over 100 pounds also. She had triplets. She could not keep up with them. She couldn't even pick them up. And now she's doing great. She goes out with them. She can pick them up. She can run with them.
It's clear why you love your work. You make a great impact on people. Dr. Celinés Morales-Ribeiro, who is bariatric surgeon at Englewood Hospital Medical Center, thank you for being here, but also the work you do every day.
Thank you for having
Stay right
me.
there. We will be right back right after this. That's really amazing.